Hi and Assalamualaikum. We are from Group 7 and today we will discuss about Hodgkin's lymphoma and non-Hodgkin's lymphoma. I am Mizan Kamalina binti Parjan and my group members are Nurhanis Fatini binti Kamaruzli, Nur Farihah binti Ahmad Razaudin and Nur Aiman Syahirah binti Azman. What is lymphoma? Lymphoma is the sixth most common form of cancer. It is a type of cancer that affects the lymphocyte that can be categorized into two broader groups, which is Hodgkin's and non-Hodgkin's. It can occur in children and adults, and most lymphomas came from either B cells or T cells. Hodgkin lymphoma. It spreads very quickly, recognized as one of the most treatable cancer, less common to occur, localized single group of nodes. Hodgkin disease is usually almost entirely confined to the lymph nodes. It occurs commonly in young adults. About 1 in 6 of all cancers affecting young people between 15 and 24 years old is Hodgkin lymphoma. That is not infectious and can't be passed on to other people or family members. Typically begins in the upper body, like in the neck, chest, or armpits. The cell of origin is B cells, which the cancer cell in classic Hodgkin lymphoma are called Reed-Sternberg cells. These cells are usually an abnormal type of B lymphocyte. It is less common extranodal, and the stage at presentation is more than 80% at stage 1 and 2. Risk factor of Hodgkin's lymphoma are the person who had infected by Epstein-Barr virus, HIV, and having a parent or sibling with Hodgkin's lymphoma. Non-Hodgkin lymphoma. It is more commonly found and affects people between 40 to 70 years old. It can occur at any age, but the risk increases with age. It is most common in people of 60 years old or over. The stage of presentation is more than 80% at stage 3 and 4. And it involves multiple lymph nodes and non-contagious spread. This type of cancer can spread to almost any part of the body, including the liver, bone marrow, and spleen. It is frequent extranodal cases. It is a low-grade lymphoma, which means they grow so slowly that patients can live for many years almostly without symptoms. Although some may experience pain from an enlarged lymph gland. After 5 to 10 years, low-grade disorders begin to progress rapidly to become aggressive or high-grade and produce more severe symptoms. Lymph node biopsy. Diagnostic test. For Hodgkin's lymphoma, a bone marrow biopsy and aspiration procedure involve inserting a needle into the hip bone to remove a sample of bone marrow. The sample is analyzed to look for Hodgkin's lymphoma cells. For non-Hodgkin's lymphoma, the surgeon cuts through the skin to remove the lymph node. If the doctor removes the entire lymph node, it is called excisional biopsy. If a small part of a larger tumor or node is removed, it is called incisional biopsy. The biopsy result difference showed the presence of Reed-Sternberg cells in the Hodgkin's lymphoma, as shown in the circle shape in the picture. Pathophysiology of Hodgkin's lymphoma. How does Hodgkin lymphoma develop? Hodgkin lymphoma starts when an abnormal change to the DNA of a white blood cell, called lymphocyte, causes it to become a lymphoma cell that, if untreated, result in the uncontrolled growth of cancerous lymphocyte. These cancerous cells will crowd out normal white cells, making the immune system can't guard against infection effectively. Lymphoma cells then grow and form masses, usually in the lymph nodes that are located throughout our bodies in the lymphatic system. Lymphoma cells can also gather in other areas of the body where lymphoid tissue is found. Hodgkin lymphoma is distinguished from other types of lymphoma by the presence of Reed-Sternberg cells. Other cells associated with the disease are called Hodgkin cells. Hodgkin cells are larger than normal lymphocytes but smaller than Reed-Sternberg cells. These differences can be observed under a microscope and further identified by special pathology tests. This is important information that can help doctors to determine a patient's Hodgkin's lymphoma subtype. Pathophysiology of non-Hodgkin's lymphoma. About 80 to 85% non-Hodgkin lymphomas arise from B lymphocyte, which the remainder arise from T lymphocytes or natural killer cells. Either precursor or mature cells may be involved. The stage of lymphocyte differentiation at which the oncogenic event occurs determines the disease presentation and outcomes. Most lymphomas are nodal with variable involvement of the bone marrow and peripheral blood. A leukemia-like picture with peripheral lymphocytosis and bone marrow involvement may be present in up to 50% of children and about 20% of adults with some types of non-Hodgkin lymphoma. Hypogammaglobulinemia, caused by the progressive decrease in immunoglobulin production, is present in 15% of patients at diagnosis. This increases the risk of serious bacterial infection and may require replacement with IV immunoglobulin. Whoever follow a path on the pursuit of knowledge, Allah will make easy for him a path to paradise. The angels lower their wings in approval of the seeker of knowledge, and everyone in the heavens and on earth pray for forgiveness for the seeker of knowledge, even the fish in the sea.